It's one of my patients. So she lost some weight and also had reached an age where her elasticity in her skin had changed. She has some little sunspots. She just was feeling like she was seeing her lines and wrinkles. And the most difficult area to treat of the skin is the area around the mouth, kind of in between the nasolabial lines, in between the marionettes, we call them the commissures, but the corners of the mouth. That whole area is very difficult to treat with anything else. And we have long used Botox and fillers and lighter resurfacing options to try to, in combination, correct those areas. And so she was really bothered by that area around her mouth and also starting to see some aging around her eyes, her forehead, her glabella, those lines up there between your eyebrows, and was interested in having some resurfacing and also trying to get any amount of skin tightening that we could, although that is probably realistically somewhere between 20 and 30% skin tightening. Those were our goals. So we discussed surgery versus this peel as sort of two ways to approach some of her concerns. The beauty of a facelift is it gets rid of excess skin. A facelift gets rid of excess skin, and it gets rid of, and it allows us to reposition structures to sort of support fat pockets and things like that. But a facelift does not address the area around the mouth, and it doesn't address crow's feet and other things adequately. And so that area around her mouth being her biggest concern, I felt like if she was going to pick something, this peel was probably going to be her best first option. And then if she decides to come back and do surgery at some point, she can do that. But that was our goal and the reason for sort of leaning toward the peel as a first option for her. She had no surgery. She's very happy. She looks back at pictures and is very pleased with her results. She feels like it was worth it. I will say she's smiling slightly in this second picture, which changes a little bit, but what you can clearly see are the lines around her, on her forehead, the shine of her skin, the pigmentation changes are significantly gone. On her chin itself, you can see that the cobbling of the skin on her chin and some of the lines around her nose are significantly improved. There are some lateral lines below the corner of her mouth that even with the smile were present before, even when she animated, that are not present in the after picture. The area around her eyes as well, you can see some tightening of the skin on the eyelids, which I also treat at the time, and a little bit of smoothing to the lower eyelid as well. And then again, with her smile, we see a little bit of lines around the eyes, but when we see her relaxed, those lines are significantly improved, if not gone. Her neck was treated with topicals. I did not actually peel her neck. So I think that's just some smoothing with some of the other things that we were doing to her skin, but I did not peel her neck. The neck skin is very tricky as far as its ability to heal, so you have to be very conservative with that area. I think this is a good angle, and it being closer, you can really see the changes of the skin all the way at the top. You can't quite see her crow's feet area, which is improved. It doesn't fan down onto the cheek as much. But what we can see very well is the area around her mouth, her chin. The lip lines are significantly improved. As you come down the nasolabial fold and marionette lines, way less skin laxity, much more tightness of the skin along the jawline. And then it's extremely obvious how much her skin is refreshed and rejuvenated just in its texture, its color. There's a nicer, brighter, more vascular complexion to it as far as the shine to it, whereas it had been a bit flatter in its tone and definitely had some more hyperpigmentation in the upper picture, the before picture. If you want to schedule a consultation for the Luxe Peel, you would call us at Portland Plastic Surgery Group. Our number is 503-292-9200.